Now, RFK Jr. is well known for his criticism and skepticism of the COVID vaccine and other immunizations. And now sources tell us that RFK Jr. is recommending a fellow vaccine skeptic to lead HHS, the Department of Health and Human Services, if Trump wins the White House. His name is Joseph Ladapo, and he's Florida's Surgeon General right now. And we are told that he's actually being seriously considered and vetted for the potential position. Now, Ladapo drew criticism during the pandemic for repeatedly questioning the effectiveness of vaccines and even appeared on 2 far-right conspiracy theory podcasts to push misinformation. Vice President Harris reacting to the news just moments ago, calling Kennedy Jr. the exact last person in America who should be setting health care policy for America's families and children. Joining me now, Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation. He also served as the former acting director for the CDC, and he also is former chief correspondent for health and medical stories here at ABC News. Good to see you, Richard. So the former acting director, as the former acting director of the CDC, how would you be feeling right now if RFK Jr. was about to be your boss?
Well, good, first, good to see you as well. It's always nice to be here. You know, I practiced pediatrics for more than 30 years, and I've spent my whole career working in public health. And you know, there is not one thing in public health and pediatrics that we know has more proven benefit than getting children vaccinated fully and on time. And so the idea that someone in leadership would be questioning the safety of our vaccine system is really chilling. We have the safest vaccine system in the world. The approval process that our vaccines go through to ensure that anything we're giving to children, to adults, is safe. It's the system that all other countries look to. You know, when I was at ABC, I reported on measles outbreaks in California, and they occurred because of parents deciding not to vaccinate their children. If that were to happen, if we were going to give more parental choice around vaccination, I would expect to see outbreaks of measles, of whooping cough, of diseases that we are trying to wipe off the face of the earth. You know, we vaccinate not only to protect our own children, but because we know that by communities being vaccinated, those children, those people in communities who may have medical conditions that put them at greater risk, for whom vaccines may not work as well, they're protected as well. So it is very concerning to me.
So RFK Jr. has been an advocate for banning pesticides, food additives, seed oils, ultra-processed foods, but experts warn that that would actually upend our existing food system. What are your thoughts?
Well, you know, I don't like to confuse the issues. It's really important that we work to ensure that pesticides are not contaminating our food system, and we have systems in place that work on that. We know that ultra-processed foods are not very good for us in terms of their quality and nutritional value. That's something that's really important. But when you put all these issues together, those issues where there's some validity and some truth, with issues where there's absolutely nothing to support them, it can be really confusing. And so I like to recommend to people that they turn to trusted sources, you know, their own doctor, for those questions, because people deserve to have their questions answered, but they shouldn't be answered by politicians, individuals who really have no expertise and are spreading false information.
Are there any specific proposals that Trump has put out there that RFK Jr. has jumped on that stand out to you?
Well, you know, I don't engage in political discourse as the head of a philanthropy. We don't do that. But I can tell you this: our public health system is under great threat and stress. You know, one thing that there appears to be some bipartisan support for is vilifying our public health system. What we need to do is invest more fully in our public health system so It's ready not just for disasters and epidemics, but so that it can be addressing more fully the other things that are impacting health: chronic disease, heart disease, issues around opioid addiction and overdose, injuries, violence prevention. These are all things that public health can have a big role in. And as we saw in 2020, public health declared racism to be a major public health issue, but they backed away from it as there's been blowback across the country. Public health has to lean in and ensure that every single person in our country can lead their fullest, healthiest life. And that's something where political parties should be able to come together on, because it affects every single community in our country.
So if Trump is elected, we could potentially have at least 2 anti-vaxxers as top officials. Your reaction to this growing trend of distrust in our nation's top health agencies, and how does it only hurt the public more?
Yeah, whenever you see people in political positions who are spreading misinformation, we saw it consistently through the early parts of the COVID pandemic, people lose their lives because they lose trust in the institutions, state, federal, local, tribal, public health that's there to protect people. And when politicians are leading on public health policy, it's a very dangerous situation. Thankfully in our nation, not everything is governed by the federal government. States have a role to play here. And we're seeing a lot of people in communities demanding that their public health systems are more responsive to the needs of every community. That's really important. But it is very concerning, an idea that you would have individuals leading our major health institutions who don't believe in the value of vaccinations. Vaccinations save millions of lives around the world every single year.
Dr. Richard Besser, always great to see you, Doc. Thank you so much.
My pleasure. Thank you.